Hi everyone, my name is Michelle and I'm currently an officer of the Red Cross Club at my school. I am very passionate about helping and teaching others how they can help themselves as well as those around them. I myself am CPR certified, and in this lesson, today students will be able to learn what is CPR, how it is helpful, and how to perform it safely and properly. First things first, what is CPR? CPR, also known as cardiopulmonary resuscitation, is an emergency life-saving procedure that is performed on someone who has had a cardiac arrest. Some examples of a scenario in which you should perform CPR on someone includes when they have received an electric shock, had a heart attack, or was just drowning, in which the victim has stopped breathing or their heart has stopped beating. CPR is comprised of chest compressions and rescue breaths. However, just as a reminder, today we will not be learning how to do the rescue breaths, and we will only be learning how to do the chest compressions, or hands-only CPR. The chest compressions are vital. Blood carries oxygen to different parts of the body via the heart. If body tissues do not receive oxygen, they begin to die. When we do the chest compressions, we are helping the heart to get blood to vital organs such as the brain, so it is important that we do the compressions, and when we are doing them, that we are pushing deep enough. But why should you learn how to do hands-only CPR? Though traditional CPR is better than hands-only CPR, hands-only CPR is better than no CPR at all. In case of an emergency, you can be the difference for someone you love. Studies have shown that 70% of out-of-hospital cardiac arrests happen in homes. 90% of people who suffer from out-of-hospital cardiac arrests die. CPR, especially if performed immediately, can double or even triple a cardiac arrest victim's chance of survival. With hands-only CPR, you can save a life, whether it's a friend, family member, or a total stranger. Now without further ado, let's get started. Hands-only CPR involves two very important but very simple steps. When you see an unconscious person, the first thing you do is call 911. Either ask someone nearby to help call 911 or make the call yourself. Check your surroundings and make sure there is no potential danger around you. Then check the person. Gently tap them on the shoulder. Do not pound them or shake them vigorously, just a tap. Look for signs of life. Tilt their head and lift their chin slightly to open their airway. Lean in towards the person's nose or their mouth to check for breathing. If there is no movement, breathing, or any sign of life, then begin to perform the chest compressions. Kneel next to the person and place one hand over the other and interlace your fingers as shown, with your non-dominant hand over your dominant hand. Place the heel of your hand on the center of the person's chest, or their sternum, and push down hard and fast. Each push should be at least 2 inches and no more than 2.4 inches down. Make sure your arms are straight and your elbows are locked. Position yourself in a way that your shoulders line directly above your hands. You should maintain a steady rhythm of 100 to 120 beats per minute. If you don't exactly know how fast that is, that's okay. Just think of a song. Some songs that have the correct pacing include Staying Alive by the Bee Gees, Hips Don't Lie by Shakira, and ABBA's Dancing Queen. In fact, the Baby Shark song is a great example of a song that is 100 to 120 beats per minute. So don't be afraid to play a song or hum quietly when performing CPR on someone. You must not stop and then start again when doing the compressions. The movement must be continuous. The only reasons why you would stop performing CPR on someone is if the scene has become unsafe, there are signs of life, such as breathing or movement, another trained responder arrives and takes over, an AED is ready for use, or you have become too exhausted to continue. You must remember that CPR may cause injuries to the individual, such as damage to the ribs or the cracking of the sternum. However, despite these injuries, you should continue on with CPR, as saving a life outweighs the presence of a few injuries. So what questions might you have? Well, you might be wondering, is hands-only CPR enough to save someone's life? Yes. As said before, traditional CPR is better than hands-only CPR, but hands-only CPR is better than no CPR at all. Fast and hard chest compressions can keep a person alive long enough until help arrives. Do you need to be CPR certified in order to perform CPR? No, technically, you do not need any formal training or any special certification to perform CPR. However, you do need the education. Knowing CPR can possibly help you save a life one day. If someone near you suddenly has a cardiac arrest, don't be afraid and just be prepared. However, in a situation where someone were to collapse from a cardiac arrest and another person nearby is actually CPR certified, allow them to take over and handle the situation. Just be aware and be available to jump in to help at any time. Now, you also might be wondering, well, when and where can I get CPR certified? Technically, you can get CPR certified at any age, for there is no actual age requirement. The ability to actually perform CPR is based more on your body strength, and it has been known that children as young as 9 years old can learn and retain CPR skills. I was personally CPR certified last year at my local youth Red Cross chapter, where I took a class and was tested to see whether I actually knew how to do CPR. But you can get CPR certified with an online course through the American Heart Association or through the Red Cross. You can also get CPR certified at your local school or your local fire department. If you have any other questions, don't be afraid to search it up. And you can even email me. And here's our lovely video.
If you see an adult suddenly collapse, it's important to act fast. Just use hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest. Then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push at a rate of 100 beats per minute, which is approximately this tempo. Let's hope you never have to use hands-only CPR. But if you see an adult suddenly collapse, don't be afraid to try it. All you need to remember is to call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life. Hands-only CPR should only be used when you see an adult who has suddenly collapsed and is unresponsive. To learn more, call 877-AHA-4CPR or visit handsonlycpr.org today.
Now let's recap. What are the 2 simple steps? Yes. Call 911 and push hard and fast. How far down do you need to push? And how fast? Absolutely. Wonderful. Now you know hands-only CPR. Congratulations.